Kia ora. My name is Sue Hutton. I am a manager with the Ministry of Education Additional Learning Support Team. I am going to share with you information you might need if you have a child identified as having a need for additional learning support. Your child might be identified at birth or at any time as they develop and grow. The Ministry of Education team can come alongside you as part of a team supporting you and your child. It is not necessary to have a diagnosis to get the support of the Ministry of Education Specialist Service team. You, your family, the Early Childhood Centre teacher, or someone in your community might identify your child as having difficulty with their development, learning, mobility, behaviour, communication, or a sensory need like hearing or vision. A health professional such as the doctor or Plunkett nurse might also suggest or identify that your child has a medical condition or a disability that is likely to require additional support with their development, learning, mobility, behaviour, communication or sensory need. Any of these people, including you as the parent, are able to request the support of the Ministry of Education by making contact with your local office. You will be asked to describe your concern, and you may then be offered some advice and guidance over the phone, or be sent some information to read and strategies you can try. If your child's needs sound like they are sufficient to need additional support from the Ministry Specialist team, then you will be offered an appointment with a specialist to assess those needs. The Ministry Specialist will work with you and other team members around your child to develop a support plan for home and for the Early Childhood Centre or school. From birth to 5 years old, you could be supported by specialists from the early intervention team, such as early intervention teachers, speech-language therapists, and psychologists. Early intervention staff may then support your child's transition into school. Now let's talk about how the Ministry of Education support works. What is the role of the learning support in education? Special education is part of a team that might work with you and your child from birth through to when they leave school. Early intervention staff provide strategies and support to your family and the Early Childhood Centre. The early intervention staff may support your child's transition into school. Schools are directly responsible with meeting the educational needs of their students. But if your child has high needs, special education directly funds a level of support for them through the Ongoing Resource Scheme, known mostly as ORS. If your child is at an independent or a private school or is homeschooled, they might still be able to receive some of the supports described here. The Ongoing Resourcing Scheme, or ORS, as you will hear us talk about it, it provides resources for a very small group of students throughout New Zealand who have the highest needs for special education. You will need to work with your child's teachers and specialists to apply for this ORS resource. Sometimes this is done at early childhood. Students are eligible when they meet detailed criteria and require intervention from specialists or specialist teachers to access the New Zealand curriculum. The ORS funding criteria are complex and are assessed as case-by-case basis. They relate to areas of learning, hearing, vision, mobility, and language, and the use of social communication. This comes in two levels. You could get very high or high. Applications are appropriate for the children with the highest special education needs. They get it when they transition from early childhood to school and they are identified with a significant increase in the level of funding. It may cover extra support for an additional teacher, support from specialists, supports from a teacher's aide, or funding for small items your child might need in school. There is also a subsidy or an allowance for a taxi to transport your child from home to their nearest school. If your child is not within the OARS verified service, they may then need the communication service. This service provides speech-language therapists who can work with your child and their teachers, and if your child has high communication needs. SLTs, or speech-language therapists, support children who have difficulties with talking, listening, and understanding language. They work with you, your child, and your child's teacher on ways to work to improve your child's speech and language. You do not need to worry if your family speak more than one language, as research is showing that this does not make it any harder to learn language or to learn to speak than for other children with a disability or developmental problem who come from a family with only a single language spoken at home. The focus of the communication service is on children with high communication needs who are aged 5 to 8 years old. Listening and speaking are important parts of learning, relating to other people and being able to express needs and ideas. Another service your child might receive in early childhood or at school is the Severe Behaviour Service. The Severe Behaviour Service has a team of specialists whom schools can call in to help if your child is experiencing severe behaviour difficulties. Behaviour teams have specialist knowledge, strategies and experience and provide advice, support for you and all involved in your child's life. Positive behaviour can be taught and difficult behaviour unlearned. With strategies and support, changes can be made to a child's learning environment, both at home and in the classroom, which will help them learn more positive ways of coping and relating to others. Your child may be able to get this service if they are in years 1 to 10, and if behaviour significantly affects their learning or their ability to relate positively with other people. The school will work with you to make this referral. The support available will be a psychologist or a special education advisor who will work with your child, family and school. Behaviour specialists, your family and your child's teacher will work together with your child as their focus. Another resource available for your child is the School High Health Needs Fund. This funding is for a teacher's aide if your child has a medical condition that requires special care in order for them to be able to attend school safely. For example, if they have frequent seizures or need specialised medical equipment such as oxygen bottles or tracheotomy tubes. There are two types of this support. The School High Health Needs Fund provides teacher aid support for your child so they can attend safely, and the Regional Health School, which provides teachers to teach your child in hospital or at home if they are able to go to school because they are sick. Special education and or the Regional Health School will work with you to plan the support for your child's needs. Supporting health conditions will need a healthcare plan. This needs to be made up if there is a chronic, acute, short-term or ongoing health issue. A child with asthma occasionally is unlikely to need a plan, but a person who relies on specialist medical equipment, an insulin pump, feeding tube, a Mickey button, or has allergies that can result in an anaphylactic shock, they will need a plan. A healthcare plan is a set of broad goals that outline the approach for the school and that people will take to support your child.